Hello and welcome for an online study of fundamentals of anthropometry. Dear students, I am dealing with chapter 2 on fundamentals of anthropometry, and that is basics of anthropometry. Myself, Dr. R.P. D'Souza, I have already taken 3 sessions on first 2 chapters of fundamentals of anthropometry, and this is my last session on anthropometry. Let us see the more details about anthropometry related to nutrition, the measuring devices, the measured indices, different acts of Government of India regarding food, nutrition, national nutrition policy, role of anthropometry in homeopathy, different diseases of malnutrition, their homeopathic treatment, and finally the summary regarding anthropometry basic part. Remaining 3 chapters will be taken by other speakers. So, I welcome you for session B of chapter 2, and here we are going to deal with common uses of anthropometry. The common anthropometric measurements used in development programs include height by length and weight, and the main assessment is of mid upper arm circumference, what we call it as MUAC, and MUAC we have studied in detail including the demonstration about MUAC. So, these measurements height, weight and MUAC and other measurements are discussed in detail in the later chapters. Anthropometry is used by health providers such as doctors, nurses and other health science related people to identify individuals who are malnourished, so that they can administer proper care and further treatment. So, you all are going to become doctors, and you need to understand anthropometry as an elective subject apart from your curriculum. I have been repeatedly telling to you that this is related to anatomy, physiology, community medicine, forensic medicine and toxicology, practice of medicine, homeopathic materia medica, organon of medicine. That is why we have chosen this topic for you, though it is an elective. At the population level, when you consider the whole population of country, anthropometric data measured on multiple individuals, of course, who are selected individuals, they are based on a representative sample, and it can be aggregated to provide an estimate of the nutritional status of a population. So, you can understand the nutritional status of whole population of a country, which can help the government to make policies and different programs to redress the nutritional problems. So, anthropometric measurements are not only for our usages, as I said earlier, they are also used in industries, companies through ergonomics, and this anthropometric data is also used by government for making different policies and programs. Hence, anthropometry is useful for detecting undernutrition, overnutrition, and also for detecting severe acute malnutrition. Now, this is another term which you see here. Short form of this is SAM. SAM means severe acute malnutrition. Now, let us see how are anthropometric data used for individuals. Anthropometry is commonly used to assess the growth pattern and nutritional status of all individuals to identify whether the person is at risk or malnourished people, so there can be given appropriate medical treatment, remedies, and as a part of nutrition assessment and screening, it helps to tailor nutritional counseling and treatment to an individual nutritional status and to monitor the response of malnourished individuals to interventions, or whether food is enough to be solve the problem, or whether the remedies are required to solve the problem. That can also be assessed by anthropometric data. Anthropometry remains a key method of determining eligibility for certain care and support programs, and is critical in determining what services are needed. When you get a data from XYZ person, we can think about his or her eligibility, what type of care and support programs are required for that person. For example, assessing the MUSA of children, mid upper arm circumference of children, to determine if they have acute malnutrition, and further referring acutely malnourished children to an appropriate treatment programs. As I said earlier in earlier sessions, MUSE is a common anthropometric measurement and it is very easy, quite comfortable to the children and quite easy to assess by anybody with the help of tapes or a Shakir's tape. There are highly designed tapes nowadays available for assessment of MUSE. Here I am showing you one image which shows you MUSE tape of 45 centimeter. So, let us say they are available in a pack of 5. If you look at this image, we see that these tapes are available in 3 colors for measurement. Of course, they have a base where actual reading is made, through a window with arrows pointed towards the figure which are going to become your readings. Mid upper arm circumference tape of 45 centimeters. When you take MUSE measurements of children of or one child to find out whether that child has severe acute malnutrition, what is called as SAM, or moderate acute malnutrition, which is called as MAM, or no acute malnutrition, NAM. So, they are shown in different colors. So, of course, everywhere the universal color is green to show that it is a normal, and red color is always indicated as a dangerous. So, this tape tells you the condition of a child, whether the child is in a dangerous zone or whether the child is on safer zone. So, in between these two there is a yellow color shown here to tell you that if that is the reading in yellow, the child is suffering from moderate acute malnutrition. The readings of MUSE measurement is done in centimeters. The tape is available in centimeters, including millimeters. So, the red zone children, they are considered as suffering from SAM, and the reading is always below the 11.5 centimeter. Yellow zone or mid zone ranges from 11.5 centimeter to 12.5 centimeter, and of course, the green zone, which is a normal zone, which ranges or which goes beyond 12.5 centimeter. Is it not easy? Only this MUSE tape will tell you the story of full body, because that indicates, and that is why this is very common in practice. So, in earlier programs I told you about the bangle test. So, in the place of tape, the bangles are used to insert in the arm and to measure where it goes up to. So, that is another style, but this is recent advancement and people use this, and from amongst the MUSE tapes, the Sakir's tape is commonly used for MUSE. Well, now here you can see image of a child. Children are scared of anything which is new to them, and even for unknown people, though it is a non-invasive. The reading taken on mid upper arm, where exactly the tape is placed. I have told you how the point is taken from tip of the Ackermann process to the tip of Ole-Cronin process, and the reading is indicated by double arrow from both the sides. This is called as MUSE measurements. And measuring tape, it can be of any type, but this is a specially designed tape where the measuring or measurement data is accurate. Commonly used anthropometric devices, measurements and indices that are to be studied now. Some devices and some measuring methods we have already studied. But what are the different indices? Those indices we need to know in much detail. The human body is measured with anthropometric measuring tools devices, and the basic devices include a specially designed anthropometer. Plus we have personal scales. Then wherever required we use spreading caliper or pelvimeter or sliding caliper, soft metric tape, other different calipers including vernier caliper, micrometer, but Shakir's tape is commonly used for measuring MUSC. So, we have seen that in earlier image. Regarding indices, what we consider that we are going to see in follow through program, but prior to that, look at this image where anthropometry kit is available in the market. You need not purchase a single device or a tool. There is a kit where you get everything in one kit, which is required for anthropometric measurements in terms of tools and devices. Dear students, for your more understanding, I would like to show you one video, appropriate video, anthropometric measurements video by the courtesy of Ace Fitness. Let us watch this video and understand the more details about anthropometric measurements.
In this video, we will be discussing important considerations when conducting anthropometric measurements, as well as how and why you might use these measurements to motivate clients and track their progress. Anthropometric literally means to measure a human. Therefore, anthropometric measurements are used to assess the size, shape, and composition of the human body. We divide these measurements into two categories: body composition and body size. Body composition identifies the relative percentages of fat mass to fat-free mass. With this type of measurement, we are simply trying to identify the difference between fat mass and fat-free mass in the body. On the other hand, body size assesses the dimensions of the human body by looking at the height, weight, and circumference. This is helpful to determine a client's health and fitness status, but does not assess body composition. When beginning an exercise program, we want to take anthropometric measurements, since simply knowing a person's weight does not reveal much about their overall condition. During a weight loss program, there are going to be times when the rate or amount of weight loss slows, stops, or even reverses. However, individuals can still be losing fat and gaining lean body mass, so you'll want to be able to identify that difference. As with other assessments, taking these measurements can help to gather baseline information, assess program effectiveness, serve as a motivational tool, identify a client's health risk for excessively high or low levels of body fat, promote a client's understanding of body fat, and monitor changes in body composition. There are a variety of methods for measuring body composition, and some are more accurate than others. However, oftentimes the most accurate methods require expensive equipment and can be invasive or unpleasant to perform. Typically, the method that you will see in a gym is the skin fold measurement, which yields fairly accurate results and doesn't require a lot of time or equipment. We will now walk you through a demonstration of a skin fold measurement. Zach will be performing a skin fold measurement on Jessie using a device called a caliper. Make sure to familiarize yourself with the exact site locations as it differs for men and women. This measurement is most accurate if the client is properly hydrated and it is conducted prior to exercise. All measurements are taken on the right side of the body while the client is standing. For women, the Jackson and Pollock 3-site skin fold locations are as follows. First is the triceps. A vertical skin fold or pinch is taken on the posterior midline of the upper arm, taken halfway between the shoulder and the elbow. Make sure the pinch is maintained while the calipers are positioned perpendicular to the site and on the site location, midway between the top and the base of the fold. Pull the skin and underlying fat simultaneously and firmly away from the underlying muscle tissue. Read the dial, then slowly release the caliper trigger. The second location for females is the thigh. A vertical skin fold taken on the anterior midline of the thigh between the crease of the hip and the proximal border of the patella. The final measuring site is taken at the suprailium. This is a diagonal fold following the natural line of the iliac crest, taken immediately superior to the crest of the ilium and in line with the anterior axillary line. Body composition can be determined by adding the 3 skin fold measurements and plugging the values into the conversion tables. The 2 most common ways of assessing body size are through the body mass index chart and the waist to hip ratio measurements. Both are easy to administer and little equipment is necessary. The waist to hip ratio determines the distribution of fat on the body. We will now demonstrate how to do the waist to hip measurements. When measuring body circumference, it is important that the tape measure is even and straight, and all measurements should be made with a non-elastic yet flexible tape. Individuals should wear thin, form-fitting material that allows for accurate measurements. The tape should be snug against the skin surface but not pulled too tightly. Zach will now demonstrate how to locate and measure Jessie's waist. With the client standing, arms at the side, feet together, and abdomen relaxed, a horizontal measure is taken at the narrowest part of the torso. This is usually above the belly button and below the rib cage. To measure the hips, have the subject standing with the feet together. A horizontal measure is taken at the maximal circumference of the buttocks. Measure from the side or sagittal view, starting from the calf, and move up to the thigh. It is recommended that you take these measurements in a private setting and inform the client of what you're going to do so they feel at ease and secure. As with any assessment, you should be mindful for whom it is appropriate and any associated advantages or disadvantages. For example, clients affected by overweight or obesity might find the experience of having measurements taken to be unpleasant or even demotivating, and as a health professional, you should be considerate of that. As a health and fitness professional, it is up to you to determine the client's needs and the most appropriate assessments and the best course of action.
Thank you. By courtesy to ACE Fitness, we got more knowledge about anthropometric measurements. Now let us move towards final part of this session, and that is anthropometry indices. When we measure individuals, anthropometry uses measurements and indices. For that, I will show you one appropriate table, and understand to compare these standards, references or cutoffs to determine the nutritional status of an individual or of the population. We have to interpret from these indices. So, here I am showing you one table. Well, from this table we can understand what are the anthropometric indices, what are their readings in case of 0 to 5 years children, then in case of 5 to 18-19 years children and adolescents, and in age 18 plus above, that means in adults. And there is a special provision to have anthropometric data in terms of indices for pregnant and lactating women. Pregnancy and lactation is a special physiology in case of women. For that we need to understand their indices separately during that phase of pregnancy, phase of breastfeeding, lactation. But if you see this table, more concern is of course given to under 5 children. So, these indices which I am showing you, they differ from age to age, or they are applicable to certain age categories, and they may not be applicable for certain age categories. So, I have mentioned here which is yes, that means that anthropometric measurement is applicable for that age. For example, MUC is done in everybody under 5, 5 to 18, 19, 18 plus, in pregnant women, in lactating women. So, I suggest you to refer to this chart and understand it in more detail. Nevertheless, other 3 speakers on fundamentals of anthropometry will address these issues categorically in our follow through program on fundamentals of anthropometry. So, one speaker is going to speak on under 5 category, another is going to speak on 5 to 18 years category, and one more speaker is going to speak on above 18 years including pregnant and lactating women. So, I need not go here in much details, you will understand in details through their video in chapter 3, chapter 4 and chapter 5. Well, now let us turn towards body mass index. We have already touched this terminology in earlier session, and that is BMI. Students of physiology, they know what is BMR, but for anthropometry and for anatomy also, we should know BMI, body mass index. It is calculated by weight in kilograms divided by height in meters squared. So, answer comes in ranges below 18.5 and there are ranges and above 35. We to call people as underweight, normal, overweight, obese and severely obese. BMI is useful for detecting thus obesity, malnutrition, overweight, underweight and so on. BMI is not useful for calculating the percentage of muscle mass. So, here you do not get confused that body mass index, it is not body muscle index. So, percentage of muscles means not BMI. There is a formula for that. We have to take into consideration weight and height. So, that formula will tell you what is BMI of each person. Now, let us see the interpretation of anthropometric data. How to interpret anthropometric data and accordingly classify the nutritional status of individuals. Once anthropometric measurements are collected for an individual, the data are compared to an accepted reference to classify an individual's nutritional status. For example, growth standard, growth reference and cutoff. So, growth standard is different, growth reference is different. So, based on these references, many of which are sex specific. Sex specific means gender specific. We know males and females, two sexes, genders, because males and females grow differently, because they are though homologous, there are differences that we study in human anatomy and in human physiology. An individual may be classified as having normal nutritional status or as undernourished, overweight or at risk of malnutrition. It has got more concern when we consider the sexes. Women have to go through pregnancies and further through lactating period, breastfeeding period. So, their nutritional requirements during that period of time, it differs a lot. If you see the balanced diet for a pregnant woman, balanced diet for a lactating woman, there are prescribed balanced diet food charts and that makes differences here. That reference we have to take into consideration. The classification also indicates how severely the person is undernourished or overweight. Whenever possible, the interpretation guidance provided is drawn from WHO, World Health Organization, and there are even other standard resources. The country to country different standard resources are also available to classify. Other standard resources are also frequently used in developing countries such as our India. Nevertheless, WHO, World Health Organization, is a global organization for health concerns, health issues. So, they have provided interpretation guidance and we have to compare that with our anthropometric data. Globally, international growth standards and growth references, they exist and are useful for assessing and monitoring the growth and further classifying the nutritional status of infants, children, adolescents for some measurements. I hope you all know what does infant mean. We study in embryology. So, newborns or neonates means up to 1 month from birth, and from 1 month to 1 year we call them as infants, and thereafter they are children up to the period they hit puberty, and after puberty and before 18 years of age we call them adolescents. This includes World Health Organization child growth standards, and they are for children from birth to 5 years, and the WHO growth reference for children and adolescents from 5 to 18-19 years. So, these growth standards are to be referred while doing anthropometric measurements of children or adolescents in our country while taking the anthropometric measurements. However, while universally accepted international guidance exists for several of the measurements, I mean indices and demographic groups in this guide. For example, all measurements and indices of children from birth to 5 years of age, there is limited global guidance for others. For example, MUSE for individuals 5 years of age and older, waist circumference, etc. So, the more emphasis has been given for under 5 children. So, under 5 is a separate chapter in community medicine, most vulnerable category as far as the malnutrition is concerned, and that affects the anthropometric measurements. Demographic groups means population of specific region. You can say state wise or country wise or society wise. For measurements with no global guidance, some countries have created their own cutoffs. So, actually everything has to be provided by WHO for global guidance for all the countries across the globe. But if there are no global guidance, every country has to create their own cutoffs. We are a developing country, rapidly developing country. So, our government is working and improving this aspect that we are going to see through follow through program in next few minutes. When using anthropometry to assess an individual's nutritional status, it is helpful to consider additional information such as dietary practices, results of other medical assessments and household socio-economic status in order to better understand the situation. Dietary practices means the diet of all the people in one country is not same. It differs from region to region, from society to society, cultures to cultures, religions to religions. And that is why the full demography, when we take into consideration, we find these differences. Household socio-economic status, everybody's economic status is not the same. We have rich people, we have poor people, there are people who are below poverty line, though it is rapidly improving in our country, but it still exists. So, separately that has to be understood in order to redress it. Well, there is a NFSA Act which was enacted in the year 2013. It is called as the National Food Security Act. So, that is NFSA Act 2013. It is a law in our country that provides food and nutrition security to the people of whole India. That means food and nutrition security, like it has to be a guarantee now. Food and nutrition security to all the people of India, irrespective of whether they are rich or poor, whether they live in urban area or rural area. Already there is an act. This act has to be properly executed by the concerned people. It covers about 2/3 of the population who can get subsidized food grains through the targeted public distribution system. So, there is a subsidized food grains available through rationing, and they can be availed through the TPDS, targeted public distribution system. So, the targeted people who are in a problem as far as the food and nutrition security is concerned, this facility has to reach up to the ground level. Unless and until it is not done, the essence of this NFSA Act would not be achieved, purpose of this Act. This NFSA Act helps us to understand the National Nutrition Policy, we call it as NNP. Through National Nutrition Policy, or for the purpose of implementing the National Nutrition Policy, we have a Food Nutrition Board. It is called as the Food and Nutrition Board, FNB. FNB is a technically support wing under the Child Development Bureau, and the Child Development Bureau belongs to the Ministry of Women and Child Development of Government of India. It has a countrywide setup comprising of technical wing at the center, 4 regional offices and quality control laboratories in Delhi, Mumbai, Kolkata and Chennai. And there are almost 43 community food and nutrition extension units across the country. We call them as CFNEUs, CFNEUs, community food and nutrition extension units under the 4 regional offices, and these CFNEUs are located in all 29 states and all the union territories. That means there is a provision at the national level through NFSA Act and through FNB board as per the national nutrition policy, but this has to be rigorously implemented and honestly executed across the country in order to see that every targeted community or a person gets enough food and does not suffer from malnutrition and the malnutrition disorders. Unless and until this is achieved, anthropometric measurement data in our country will not improve. Let us see the nutritional status of India. NSI. This was in a recent past in March 2023. As per the Global Hunger Index 2022 report, the prevalence of undernourished in the population in our country stands at 16.3%. So, you can say still in our country we have 16.3 percentage of population undernourished, whereas this child stunting is at 30.5 percentage. So, quite high percentage. As I told earlier, stunting means low height, and child wasting is at 19.3%. And you know, wasting means muscle wasting, thinness, and these things are happening because of enough food, nutrition, and that is why in our country the child mortality rate due to deprivation of proper nutrition is at the rate of 3.3%. As compared to 1947, there is lot of improvement, but we will have to make it zero before 2047, and then only our India will become Viksit Bharat. Already there are provisions at the national level, implementation and execution is what required. We belong to the medical field, we are the key persons to address this issue everywhere, wherever we go through our lectures, seminars. So, that is why fundamentals of anthropometry is quite beneficial and useful elective for you all. This additional information provides insight into the direct and underlying causes of the individual's nutritional status, helping to establish an effective treatment plan and or refer an individual to other needed services. And all the required individuals are categorized into 3 categories. I am repeating it again. Anthropometry in children from 0 to 5 years of age, anthropometry in children from 5 to 18 years of age, anthropometry in adults from 18 plus years of age, including pregnant and lactating women. As I said earlier, these topics will be discussed and explored by my colleagues in their chapters. Actually, the main part of fundamentals of anthropometry, as far as the introduction, definition and basics of anthropometry is concerned, has been completed. Dear students, you are going to become homeopathic doctors. So, it is my duty to tell you all the importance of anthropometry in homeopathy. We can't say that we don't have anything to do with anthropometry. We are homeopaths. No. We study human anatomy, we study human physiology, so many allied subjects we study. And for the totality of symptoms and to coming for a remedial diagnosis, what we call as similimum, this science is also equally required for us. There are many remedies available for malnutrition, marasmus, obesity, stunting, wasting in homeopathy. There are specifics, rubrics, signs and symptoms which we take into consideration to arrive at similimum. Hence, the study of anthropometry is much beneficial to the students of homeopathy. So, my dear students, do not neglect to this subject, fundamentals of anthropometry. I hope you understood my intention. Finally, I would like to tell you few homeopathic remedies for malnutrition. You have a subject for first BHMS and that is homeopathic materia medica. So, some remedies you are already studying, you have studied, but I have shown you on the chart here in front of me. Please go through it. Common remedies for malnutrition: abrotanum, acetic acidum, Aethusa synapium, Calcarea carbonicum, Calcarea phosphoricum, Cinchona officinalis, Baryta carb, Iodium, Silicea. These are almost all of them are polycrest remedies, but they are mainly beneficial for malnutrition. Just like we know that belladonna remedy, belladonna atropa, is more useful for inflammations, swellings like boils, the swollen wounds and all that. But finally, we have to derive at similimum by taking into consideration the totality of symptoms. That is my intention to tell you that there are remedies available for malnutrition. Repertorization, while doing repertorization, you will come across these remedies when you deal with the patient of marasmus. Dear students, I have completed session B of chapter 2 and it was quite lengthy because I wanted to explain it to you in details. So, whatever I have explained to you so far, your online assessment will be based on the information which I have shared with you through these 4 videos on 2 chapters, first 2 chapters. The remaining 3 chapters will be discussed by my colleagues, other speakers. So, let me tell you once again that anthropometry in children from 0 to 5 years of age will be taught to you by Dr. S.R. Lakhamde. Anthropometry in children from 5 to 18 years of age will be discussed by Dr. M.R. Aroskar, anthropometry in adults from 18 plus years of age and above, including pregnancy and lactating women, will be taught by Dr. S.P. Dange ma'am. They will tell you the specific or particular part of anthropometry in respective category. We have to use internet sources, and you can also use internet sources further to understand remaining things. There are a lot of videos, lot of images, there are a lot of text available, that also you can avail through free internet sources. And my dear students, with this I have completed my last session, session B of chapter 2. Hope you all understood this, and it is my appeal to you all. It is a optional elective. If you find it interesting, do go through all our videos. Total 10 videos will be made available for you, because we have 10 sessions, and each session will be assessed online for each one of you by MCQs of 1 mark use each for 10 MCQs. And with this, I thank you a lot for listening to me patiently and understanding the topic. Thank you. Thanks a lot.